Thank you, Mr. Chairman, and thank you to all of our witnesses for being here today. Connectivity and broadband access are vital to Arizonans in urban, rural, and tribal areas. Broadband access provides opportunities for innovative solutions that address telehealth, education, and public safety issues in communities that lack access to these critical services. But while many Arizonans are looking forward to 5G networks, other Arizonans have been left on the wrong side of the digital divide. So I'm looking forward to working with my colleagues on this committee to improve access through smart policy and allocation of our resources, both spectrum and financial. My first question is for Mr. Bergman. I've heard from Arizonans about wireless connectivity issues affecting cities and towns neighboring the U.S.-Mexico border. Arizonans near the border have had calls dropped and experienced degraded service, and I understand the interference is related to a Mexican carrier operating the 700 megahertz spectrum band, which is the same band as U.S. carriers. This is more than just an inconvenience for Arizonans, it's a safety issue. So the harmful interference with U.S. networks creates a dangerous scenario where Arizonans can't access first responders, federal and local law enforcement, and their hospitals. So has CTIA or its members looked into the issue of spectrum interference near the border, and how can Arizonans be sure that this interference will not continue?
So thank you, Senator, for your attention to this issue. We appreciate it. We know that wireless consumers view their wireless service as a lifeline, exactly as you say. And we're familiar with this issue of Mexico recently turning up 700 megahertz service and its interference into Arizona. Our companies with 700 megahertz spectrum are working right now to try to resolve those questions with the State Department, and we certainly thank and appreciate the efforts of the State Department to work with their counterparts in Mexico. We'd welcome the opportunity to come in and talk to you further about that, and we'd welcome any support from you in trying to resolve those issues quickly.
Thank you. Well, we are here to help with that issue. My second question is for Mr. Edelstein. The 2.5 gigahertz spectrum, known as the educational broadband services, is used to tackle the homework gap and digital divide by providing spectrum for broadband services. In Arizona, the Havasupai tribe uses EBS channels for wireless routers so their members can take online classes. The tribe was recently granted 4 new EBS channels that they intend to use for telemedicine. This past summer, the FCC announced a tribal priority filing window for issuing new EBS licenses. This window allows tribes to apply for EBS licenses before the FCC auctions any remaining spectrum. So I encourage the FCC to create the tribal priority filing window and urge the FCC to make the window long enough for tribes to take advantage of the opportunity. Based on your previous work with tribal entities as FCC Commissioner and the Administrator of the USDA's Rural Utility Service, what are your suggestions to ensure all tribal communities in the United States have the opportunity to build out EBS and other spectrum resources to help bridge the digital divide in Indian country?
I visited the Havasupai tribe actually in my time at RUS. I've been there, and they do have enormous challenges, and they've I think tried to tackle them as you've talked about, these efforts that they're undertaking to do it. I think these type of tribal set-asides and the type of efforts that this chairman and previous chairmen have made have really made a difference. The problem is that the tribal areas are the hardest to serve, and yet they need it the most. They are remote. Some of them, like ours in South Dakota, also are some of the most economically deprived areas, and they can immediately get their crafts to market instead of having to go through middlemen if they can get to the internet, and yet many of them are deprived of that. So I think we need to re-examine how universal service is distributed as well to ensure that the tribes get what they need. There's no part of the country, I think, that needs attention more.
Right. Thank you. My final question is for Ms. Morris. In Arizona, telehealth can provide veterans with health care that's accessible, flexible, and patient-centered. But veterans in underserved or unserved parts of Arizona face significant challenges accessing telehealth services due to the lack of access to broadband at home. So one of the tools to help veterans access affordable telephone and broadband services is the Lifeline program. Nationwide, it helps over 1 million veterans get connected. Last year, you wrote about your concerns that the FCC's proposed changes to the Lifeline program could remove up to 70% of participants from the program. Could you discuss the importance of the Lifeline program to help veterans in rural areas access these telehealth services and the impact of the changes to the program?
Excuse me. Thank you so much, Senator, for this important question. We have indeed focused extensively on numerous attempts to weaken the Lifeline program and to cap the Universal Service Fund more broadly, which we believe would pit the various programs against one another. And you're right that veterans make up a critical component of the Lifeline recipients. Up to 13% of current users are veterans, and 30% of veterans live in rural areas. So your question reflects a large segment of a population that desperately needs access to affordable and robust internet service. What we've seen with the different attempts by the current FCC to weaken the Lifeline program is a high degree of uncertainty in the program. So their wireless resellers are unsure of whether or not they will be able to continue to provide Lifeline-supported service, and there is a looming threat to cut off, to limit the amount of money that's available to this already underutilized portion of the Universal Service Fund. So we have urged the Commission to walk back its efforts to weaken the fund and ensure that all Lifeline recipients, and particularly our most vulnerable, including tribal recipients and veterans, have continued access to the program.
Thank you. Thank you, Mr. Chairman.